Hey guys, today I want to talk to you about that big announcement that came out of the White House yesterday regarding who will and won't be eligible for certain benefits going forward. This is a pretty significant game changer for certain benefit programs. So here's what's happening. At President Trump's direction, 5 federal departments are now blocking undocumented immigrants from accessing key programs that may have been available to them before. There are more than 13 different programs that are going to be impacted by this order. And this action is intended to limit those benefits to citizens and legal residents only. Approximately $40 billion in benefits is expected to be affected. And we're talking about this today for a lot of different reasons. There's been a lot of questions on this channel about immigrants being eligible for certain things, who is and isn't eligible for what. And of course, if there are any mixed immigration status families watching this, you're going to need to be prepared for possible changes as well. So ultimately, here's what's going on. They are reinterpreting what is called the Federal Public Benefit Rule. Now, the FPB rule has been on the books since 1996, but they are modifying how it's applied and enforced, basically. So historically, this definition has mostly applied to big benefits programs that are given directly to individuals and families. For example, if a food pantry got a federal grant and then gave out food, there wasn't much enforcement on who received that or how that was handled. But that appears to be changing under this new policy that was released. So there's a lot of different agencies that are going to be in play here. And we'll talk more about that food bank situation here in just a little bit. But according to the White House press release, the Department of Health and Human Services is restricting illegal aliens from 13 additional public programs, including Head Start, health workforce scholarships and loans, mental health and substance abuse support, family planning, and more. The Department of Education is ending free tuition for illegal aliens at post-secondary career and technical education programs. And again, these are direct quotes from that White House press release. If you're having any questions about why it's worded this way, it's because I'm giving you the verbatim information that came from the White House. The Department of Agriculture is restricting illegal aliens from federally funded food assistance programs. There are some exceptions to that, it looks like, which we will be talking about here in a moment. The Department of Labor is barring illegal aliens from accessing federal workforce development resources and grants, and the Department of Justice is closing longstanding loopholes that have allowed illegal aliens to access taxpayer-funded benefits as well. So those are the 5 departments that are involved in this change. Now, I want to break down both the changes at HHS and the changes at USDA. HHS is going to be the organization that's helping you with things like Medicaid, Head Start, that sort of thing. And of course, USDA is the one in charge of all of the food and nutrition programs, which is why I want to zone in specifically on what those organizations are changing. So, under the new interpretation of the rules, the following benefits will now be classified as federal public benefits under that big long acronym for what that rule is called. And some of the programs that they're going to be limiting under this include certified community behavioral health clinics, certified mental health services block grant, which, according to what I read, and again, I'm not an attorney, I'm just a researcher here, but according to what I read, that looks like if they award that block grant to a mental service facility, that facility then can't allow anyone who is an undocumented immigrant from benefiting from the services that they provide funded by that grant, if that makes sense. The Community Services Block Grant is also going to be classified this way, as well as Head Start, the Health Center Program, the Health Workforce Programs, which include any grants, loans, scholarships, payments, and loan repayment plans available through that program. The mental health and substance use disorder treatment, prevention, and recovery support services provided by that organization. Projects for Assistance in Transition from Homeless Grant Program, Substance Use Prevention, Treatment, and Recovery Services Block Grant, and then some very specific title programs like the Educational and Training Voucher Program, the Kinship Guardianship Assistance Program, Prevention Services Program, and the Family Planning Program are all now going to be classified as public benefits, but that is not all. They also had some language in here that I thought that you would want to know, which includes this quote: "The above list is not exhaustive. Any additional programs determined to be federal public benefits will be announced in program-specific guidance." So I will be watching to see if we see this list updated, and I will try to get that news to you if we see any additional changes. Now, they also said that the notice establishing this revised policy takes effect immediately upon publication in the Federal Register. There is a 30-day comment period. What that's going to accomplish, I don't know. But that is available if that's something that you'd like to comment on. Now let's talk about what's going on at USDA, because that's going to govern all of those food assistance programs that are so critical for so many people. So the USDA administers 16 different food and nutrition programs through the Food and Nutrition Service, which is, a small branch within USDA. It's not really a small branch. It's actually quite a big one, but basically what they are saying now is that all food and nutrition programs meet the definition of federal public benefit. And there is an important catch to that, though. Even though all of these programs are technically federal public benefits, there is another provision that supersedes that rule, which means that some of those programs may still be available to people who are of an undocumented status. So you can see this is a screenshot straight from the USDA website. You can see the direct link down here at the bottom of your screen. Even though all of these programs are considered federal public benefits, the USDA is going to continue administering those in accordance with the superseding provisions, which means that these may still be available. This includes the Food Distribution Program on Indian the Food Distribution Program on Indian Reservations, the Emergency Food Assistance Program, the Commodity Supplemental Food Program, WIC, the WIC Farmers Market Nutrition Program, the Senior Farmers Market Nutrition Program, National School Lunch Program, School Breakfast Program, Child and Adult Care Food Program, the Fresh Fruit and Vegetable Program, the Special Milk Program, the Summer Food Service Program, and Summer EBT. It also says that USDA Food and Nutrition Service disaster assistance may also be exempt there where relevant, since there's all sorts of different flexibilities and waivers and different things that go into that particular kind of assistance. Now, ultimately, all of this means, I know this has been very technical, and I've done a lot of reading directly from the source material because this is such a sensitive issue. I'm also choosing not to engage in chat on this particular video just because I know this is a very controversial issue, right? There's a lot of people with strong opinions on both sides of this, and I don't have any interest in weighing into any kind of debate. I'm just trying to convey the information to anyone who is interested, since this is something that could have an impact on benefits. So ultimately, what we're looking at is that it now looks like even indirect aid, like food from a food bank that receives a grant, will be counted as a restricted federal public benefit going forward. It looks like SNAP retailer approval is also now going to be considered a commercial license, which means that may not be available as well. And some programs may still be available due to limited regulations that supersede those rules, such as those that we featured on a previous slide. But for the most part, all of the programs at USDA, as well as many of the programs from HHS and other organizations, are now going to be classified as a federal public benefit, even if they weren't classified that way before. So just be aware of that going forward. Now, if you're interested in more updates like this, you are welcome to opt into our email list. We send a couple of emails a week, just making sure that you didn't miss any of our videos or any of our website content or anything else that we found that we thought might be useful to you. So feel free to opt in there if you would like more updates like this. Thank you for watching, and I will be back again soon with more tips and tricks to help you get the most of your benefits.